Welcome, everyone, to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey, and today I have Dr. Diana Breister, and she is one of our board-certified plastic surgeons, and she's going to talk today with us about feminine rejuvenation and specifically labiaplasty. And so welcome, Dr. Breister.
Hi, good morning. Thanks for having me.
So some women, well, probably most women, have, some issues kind of how to bring this up, to talk about the lady bits, as we call them. But,
Yeah.
they can feel when you get into vaginal health, like I think it's becoming a little more mainstream, but it's not something that people are super confident of talking about. And so, how do you kind of make it so that it's not awkward for them?
Well, labiaplasty is, as you probably know, it's why we're talking about it, it's becoming more and more popular, which is great. So more and more women, younger to older, are becoming more aware of this procedure. I think what happens is we don't know if our own anatomy is per se normal until you become a certain age, and then you start thinking, oh wait, this is irritating me, or is this normal, or is this how it should be? And a lot of OBGYNs will examine a woman and say, you're totally normal. And they are totally normal. That's the thing about labia is that they're as different as earlobes. They come in all shapes, sizes, thickness. And they're all per se normal. However, normal to one person might irritate them or bug them a little. And I think with becoming more aware, we wear tighter clothes, the athleisure movement, we're wearing yoga pants every day or, tighter clothes. I think women have become more aware due to that, due to other, factors. So when they finally discover that there is a procedure for this, I think they're like, wow, this is great. And so then that, there's obviously we're all a little shy around our private parts. So there's of course going to be a little stigma or, showing your body to a stranger is never super comfortable. So I find it's a big step for a woman just to make the appointment. So just to make that appointment, I think is a huge leap. Like, okay, I'm going to be facing this. I'm going to get an opinion about it. I'm going to have to be examined. So I'm always very comforting and reassuring just to try to get them to relax a little bit. Before we even examine them, I say, look, I'm a woman. I get it. This is not comfortable, but you're not alone. There's nothing, wrong with you. I'll tell you that right now, but there's nothing wrong with wanting to change things too a little bit. So they kind of I think they take a deep breath, there's a sigh of relief, and then we go from there. So I think that's kind of my approach. That's my understanding of it anyway.
Well, I think that makes a really good point is, you could apply that to eyelid surgery. It's normal to have extra skin in your upper eyelids, and we don't think twice about wanting
Right.
to change that. And
Mhm.
so if you have extra skin in your labia and you want to change that, it's really the same thing. But it's again, because it's kind of our privates and it feels funny
Mhm.
to maybe talk about it.
Yeah.
And so what percent of women do you think might have some degree of aesthetic or functional concern that region?
Well, that's a very hard question to answer because, one woman might have an excess of 2 or 3 centimeters of labia hypertrophy, as we call it, and it doesn't bug her at all. But then the next woman might have that exact same amount and it really bothers her. So, I think they're all different. They all probably have some excess to them. And whether that excess, like I said, what percentage that is, who knows? But once a woman kind of becomes more aware of the anatomy and once they find out that there is something to do to change it, I think that's kind of the best part.
And do you think there's like any reasons why women might not reach out for help with this more often? Do you think it's just because they don't know that there's something that can be done?
I think a lot of it, they just don't know. A lot of it could be an OBGYN saying, you're normal. There's nothing wrong with you. You don't need anything. I think a lot of it is women and our own kind of not shame, but we're kind of reticent about putting resources into ourselves sometimes. It's elective, it's not necessary, so just with cosmetic/elective surgery to begin with, there's a little bit of trepidation um on the part of women just because of, you got to get over those hurdles. And luckily in this day and age, we are getting over the hurdles. It's becoming a lot more mainstream to want to change little things about ourselves. It's not so stigmatized. But like I said, the reasons are many. They can be anywhere from irritation, pain, discomfort, don't like how they look in yoga pants, trouble with intercourse. Sometimes the labia can be several centimeters, and those they, kind of get pushed in and out, and that's not comfortable for a woman. So there's a number of factors that a woman could be wanting to change that.
Right. And I would think, this is something that you could be born with, where that's just your anatomy.
Absolutely. And I think 99% the genetic is the number one most, even after childbirth, yes, and menopause. Things can
Right.
change a
That's what I
little,
was
like
wondering next.
everything.
Yeah, like maybe they were fine back when you were younger and now
Yeah.
you've had a couple kids and you're and
Like
I
everything, things change and things get a little deflated and things can get a little stretched out. So, yes,
yeah.
with time and age and childbearing and menopause, those things can definitely exacerbate what was there and what was possibly fine in your 30s and 40s.
So, but for the people who, young women who, and especially I think athletes, this is what I've kind of been, hearing about is that, athletes, especially women who are wearing some tight
Hmm.
clothing, gymnasts or rowers, or, there's a
Yeah,
lot of different athletes where what you're wearing, tennis court, yeah, no, it's fine. They have a skirt, but if
yeah,
you're wearing something that's super,
form fitting.
showing form fitting, there you go. It is how young would you operate on a patient who had this problem?
I think I would probably, probably 17 or 18 years old is probably what I would probably the youngest I would consider. Just we just want the woman to be, really a good understanding about her body and things like that. So, yeah, I mean as young as I think a woman of 17, 18 years old, I've done breast reductions as well on women of that age. So, it can become a problem, at that age, and at that point, there's absolutely no harm or no repercussions or consequences of doing a surgery like that, in the right hands, obviously.
Yeah. And so that leads me right exactly perfectly into the next question, which is, why is a plastic surgeon qualified to treat these kind of concerns in instead of, let's say, a gynecologist or a urologist or a urogynecologist?
Yeah. Well, the issue is mainly an excess of skin. Okay. There's not nerve issues or the urinary tract involved or other things like that. We are really not talking about, internal vaginal structures. The labia is an external structure of the vulva. So that basically means it lives on the outside. So as plastic surgeons, we have such extensive training in how to deal with skin, excess skin, laxity, things like that. And we are very well trained on all areas of the body, from the breast to the abdomen to earlobes to labia. So we do get extensive training in that, and because we have that extra sense of aesthetic concern, that's who you want to be with. Now, the OBGYN, they get it, they understand it, but frankly, they're more geared to solving problems of that area. They're going to be dealing with infections or tumors or masses or things like that absolutely we need their expertise certainly to the functional and medical problems that can happen for a woman. But when it comes to this is the labia. It is external. It is usually part and parcel of wanting it to look aesthetically pleasing. A plastic surgeon who has experience in this area is going to be your absolute go-to.
So, are there any reasons if you saw a patient that is there any reason you might send that lady to another specialist, or is it
Well, like a contraindication or they need an
Yeah.
evaluation by another doctor. I mean, I can honestly say I don't, maybe been once I've ever done that. And that's going to be if the woman comes to you for a labiaplasty, but their actual issue is something else. Maybe something internal is bothering them. They think it might be the labia and they think you might be the right doctor, but indeed they have maybe a stricture internally or they're having, some other problem that fixing that or trimming that external labia tissue isn't, the answer. But I can honestly say I've only seen that maybe once or twice. There's so much information now out there on the internet that most women can become educated in what the labiaplasty is, and they usually, wind up in the office, and they're all good candidates. They're all good candidates.
that's what I was just gonna say. Is there anything that would prevent someone from being a good candidate?
Not really. As long as they're healthy, as long as they have the right expectations, that's obviously part and parcel of choosing your patients and making sure they're good candidates. So it's just a matter, the only major contraindication is going to be if they have, an unreal expectation. You just want to make sure that, you don't want to do something that they're going to be disappointed in.
Now, can you explain a little bit about the actual labiaplasty surgery? What actually are you doing?
Sure. So, anatomically, it's almost, I wish I had a picture. We have the vulva. The vulva is the term for basically the whole area down there. And that vulva consists of a labia majora, which are the outside lips, and the labia minora, which are the inner lips. And in the 90% of these procedures are going to involve the inner lips. Those are the area, the labia that protrude a lot. So now sometimes it can involve the labia majora or the outer ones. And there are procedures also that can help to reduce sometimes the size or or change the shape a little bit. But 98% of the time, we're going to be talking about the labia minora, which is the inner structures that actually close, off our vagina and help to create a protective kind of closing of that area. So those structures are just trimmed very, methodically and depending on how the excess tissue is arranged. Most likely we do a rim trim. So we're basically trimming the whole like outer edge of it and then, applying some little sutures that are very fine and they dissolve with time. And that's really the crux of it. Now, sometimes this can also involve what we call a clitoral hood reduction. So there is tissue that is called the clitoral hood. It's a little veil of tissue that basically kind of covers over the clitoris to give it some degree of protection. And just like anything else, there can be, unlimited amounts of variations of that tissue. And sometimes the woman's labia minora can kind of lead up into that clitoral hood, and that can require some tissue reduction as well.
Now, I'm assuming this is under general anesthesia, right? So, how long would they be under general anesthesia for this?
So the good news is that it's a pretty quick procedure. It's about anywhere from an hour to an hour and a half at the most. We can use a light general anesthesia. Some people can actually do it under a local. My personal choice is to do it under more of a general. I find that it's more comfortable for the woman to, just to be asleep for that. So it's a light general, anywhere from an hour to an hour and a half of a procedure. And then I'm sure you probably want to know a little about the recovery.
Yeah, I
Okay.
do.
So once the procedure is done, the most critical thing is going to be the 48 hours after that procedure. And that's going to be the most critical time that the woman is home, she's relaxing, she's laying down, and she's using some ice packs. The ice can be very instrumental in helping to reduce swelling, help soothe any discomfort, and just get those tissues off to healing properly. So I'd say about 2 to 3 days of kind of strict being at home. We don't want you going to a soccer game. We don't want you walking your dog. We don't want you preparing a meal in the kitchen because that gravity and standing up just, blood is going to rush to that area and there can be a problem. So the initial 2 to 3 days has to be pretty strict of doing pretty much nothing but relaxing. After that, if you can get through those 2, 3 days, usually then you can start, doing more things if you need to go to work. We it would be probably fine. We just want you to maybe sit on a donut cushion so you don't have direct pressure on the area. Um, you could drive, you could run some errands, you could do, kind of daily activities after that time. Now, we don't want you to be exercising vigorously till about 3 to 4 weeks. So we just want to make sure everything is sealed up, healed up. We don't want any problems with infection. So we kind of put off exercise for about 3 to 4 weeks.
So I'm assuming you can go home the same day
Yep,
that you have
absolutely.
you just is the key is to stay quiet and do, because I so what would be sort of the complications if a person completely ignored your advice and
Okay.
started,
So, yeah, the
dealing with the
issues.
dog and the kids and all that?
Yeah, yeah. So what can happen is number one is bleeding. So that can be kind of scary. A woman can, have a lot of bleeding and what's going on. They could possibly have a hematoma, which thank goodness I've never seen. But if someone, really, that the hematoma is kind of a large collection of blood. Um, that's the first issue that can happen. Secondly, the tissues swell so much that they pop open. So that's called dehiscence or, wound breakdown. So that's going to be the number one thing that can be problematic. If someone just is kind of doing their thing, going to the soccer games, they're going to come in after 3 or 4 days and their wounds may be totally open at that point because the swelling put pressure onto the tissue and so much pressure that the tissues couldn't hold it. So it is very critical. And then with that, it's a lot longer of a healing process and there's more risk of infection. And then the last thing is, when a wound can open, it can become infected. I mean, any wound can become infected. That luckily is a very low incidence, but that also is a potential possibility if you're not compliant with those instructions.
Now, if you can't exercise for, let's say, 3 to 4 weeks,
Mhm.
vigorous exercise in the bedroom, what do you advise in terms of waiting until you have sexual activity?
Okay, so that's a great question. Roughly about 4 to 6 weeks before we want, the pressure and the friction on that area. It just depends on how extensive your surgery was, but probably on average by 4 or 5 weeks, that area is healed up and ready for activity, if you
So
will. And
clearance.
I do.
So you give them clearance, I take it. You'll
Yes,
sign
yes.
off on,
That's
okay.
right. And then we always let them know there's going to be healing that's still involved. There's going to be some scar tissue in that area and that scar tissue can be tender. So it's going to be important to know that that first couple times of, having sexual intercourse can be a bit uncomfortable. So that always goes away. It's just a matter of a couple weeks to maybe a month or two before that tissue completely heals and is back to normal. Initially, it's always recommended that they use a little bit of lubrication just to reduce some of the friction. But yeah, they can usually start by about 4 to 5 weeks, and usually by 2 to 3 months, it's perfectly no pain at all.
So if a woman is, and I feel like this is could be in a way part of a mommy makeover. So,
Mhm.
maybe a
Yeah.
woman is thinking, I'd like to get rid of the extra skin by my tummy. Is
Mhm.
this something that you could combine at the same time?
Absolutely. It's a procedure that goes well with any other procedure. Because of it's short, it doesn't add a lot of time. They're going to be recovering anyway. So it's actually something that we oftentimes combine with either some facial surgery or some breast surgery or any other surgery. Hey, I want to do that at the same time. It's an excellent idea.
Yeah. Yeah. Now, I want to also address what I don't know what to call it, but the area just above
The
the
Mons.
the
So we
Mons.
call
Oh,
that
there we
the
go.
Mons
Is that
pubis.
because it
Mhm.
can be puffy there, and for some
Yeah.
women, is that something that you can also address while you're doing an
Absolutely.
examination or surgery?
Absolutely. A lot of, women, if they gain some weight, they find that area does become a little puffy. So liposuction is a great option for that area. I mean, sometimes if there's been a lot of weight loss and changes, sometimes that does require what we call a monsplasty, which actually lifts up the skin and removes some of the skin, which can be done at the same time as the tummy tuck. But yes, the Monsplasty or the Mons liposuction can absolutely potentially be addressed at the same time as a labiaplasty.
That's wonderful. Yeah,
Yeah,
I haven't heard of that, but I was like, I
yeah,
know, I know
yeah.
I know that's a thing. So,
It's
um,
definitely a thing, and all shapes and sizes. It comes in all shapes and sizes as we age, as we put on weight. It can definitely settle there, especially at maybe after a C-section. So yes, it's an absolute area that I think can go, along with that labiaplasty and be addressed as well.
because I feel like a lot of what we're talking about, well, really with any plastic surgery, but it's comes down to confidence. You want to feel more
Yeah.
confident either in your clothes or out of clothes or while you're exercising. Because I could think if you love to ride bikes and your labia are just there's just too much of them,
Ah,
then that this would be you're feeling more confident, you're feeling more comfortable. Um, so, what is sort of the first thing that patients will say when after surgery and they see and feel that difference?
well, they honestly, the first 1 to 2 visits, they're still kinda swollen, and it can look a little, not, not right away because it's swollen or bruised. So the first few visits, I even just advise them, just you don't even need to look, just let's put some ice on it. But after about 3 to 4 weeks, when the tissue has settled down, they are absolutely thrilled. They basically walk into the office just almost with a skip in their step. There is a change. They feel more confident. It's almost like a sigh of relief. They're like, "Oh my god, I'm so happy. Like I'm so happy that's gone." It really emanates from their whole presence a lot, which is kind of strange, but it's true. We are a function of how we feel about ourselves, and if that's just a source of like, a little ick that you don't really like, once that's fixed, even though you're not, showing that to anybody, it doesn't matter because you just feel better. And that I think is the number one reason why I'm actually in this field is just to, help women feel the very best they can because I think that's just so important. So they are yeah, it's a very rewarding surgery because of that. They feel amazing and they feel so great. And I think also it really, and this is something we're not really talking about because sex is kind of like taboo in this country of ours. I don't know why, but it is. We don't talk about sex very much. But sexual confidence is super important, I mean, think about it. That, we all as women, we know sex is really only as good as we feel about ourselves. So that's
True.
just an honest, if we feel better about ourselves, it's better.
Yeah.
So that's a huge part of this. I think women become extremely more just confident in their sexuality. And so that's a huge part that we don't really talk about, but it's major in how that changes that.
Now, is there ever a circumstance where insurance is going to cover this? I'm guessing it's a hard no, but you never know. So I'm asking.
You know, in one time in my 20 plus years of being a surgeon, there has been one case that it was so exaggerated and the problem was so great that it actually was causing some really bad infections and irritations and yeast infections. So it got covered, but that was a struggle. So I would say for the most part, no, it's not going to be
Okay.
covered unless it's such an extreme case.
Okay. Now, I looked on our website just to
Mhm.
remind myself, and there aren't any before and after photos on the website of labiaplasty, and I can understand why that might be the case. So, but I know that we've got hundreds of photos
Mhm.
to be able to show patients. So, is
Yeah.
that something that you go over in the consultation?
Yeah. So, I'm not sure why we don't here at La Cosmetic because I know other doctors do have those
And we
before
might
and
have to
afters.
change that too.
I think we do have to change that.
Yeah,
I'm
yeah.
gonna be yeah, I'm gonna be a proponent of changing that because
Okay.
it's very powerful to see the images. Not everyone wants to see them, but you don't have to look. But if you're interested, you need to
Right,
see it
right.
because it is so powerful. So, yes, there's a system called TouchMD that ladies here can send a patient a link and get them into those before and after archives of all the different befores and afters. We go over that in the consult, but we can also send a link, if they want to see those images before their consult, even. So I think
Oh,
that's
good.
very powerful. Yeah.
Yeah, and I think because you were talking about, the uniqueness of all of us,
Mhm.
everything in our body, but certainly
Absolutely.
I'm certainly thinking of like labia, there's got to be no two are the same.
No
And
two are the
so
same.
I would think it would be helpful as a woman to see other labia
Absolutely.
and how
Absolutely.
here's where they started, here's where they ended up, and to
Yes.
understand sort of how what they got, because it's hard to know what it.
The visual, right? What
Yeah,
what is
yeah.
it going to look like after? What are we talking about here? So, yes, that visual is so important because you can really explain this was this issue, this is how we approached it. This is this. Now your issue or your, part that we're going to address is going to look more like that.
Oh,
So, it is very powerful in relaying what the final outcome is going to look like and then they can adjust or make their expectations in line with what we can actually deliver.
now, I don't think we talked about pain very much. Is it this a painful recovery?
Honestly, not really. With the icing, I think it provides such a nice gentle relief that I think most women get through this, sometimes not even with a narcotic pain reliever, sometimes just with a Tylenol. So I would say it's surprisingly, not painful, not too painful to oh,
That's so good to know because it is such a sensitive area
I
in terms of
know.
nerve endings and, that kind of sensitive.
Absolutely.
So that's nice that it's sort of like if you do
Yeah.
follow the instructions, you're gonna feel
I th
fine.
I think the recovery is probably easier than most people would imagine. As long as they do the right thing for those first couple days, they're usually gonna sail through it.
So one of the things that um, a lot of women want to know is they're like, okay, yeah, I think I want to do this, but how much is it going to cost? And so I think on our website, we have all the price ranges of things. So it says, about 7,000 to 8,500.
Mhm.
And so what I want to assure everybody is, we can do financing for things. So sometimes people think, oh, I haven't saved up enough, but you can also, and actually one in three of our patients use financing, and that's been kind of consistent over years. Um, so it's nice. So you can think, okay, I'm ready to address this. Maybe you put some money down and then you finance the rest over, with interest-free payments or something. And so I just sort of want to let the audience know that, we do have those resources, that we have that on our website, and that can help make this sort of a very
Doable.
achievable. Yeah, yeah,
Yeah.
because I think you bring up a really good point in the confidence that they're going to feel, and it's like, I don't have to worry about that anymore. It's all fixed, and then you
Yep.
just have this. So, what's that? The price for that is, much greater, in terms of the value because you're going to feel so good.
Yeah.
So I know
It's
our
true, and
patient.
that ballpark sounds a little bit on the higher end too. It might be more, even a little more affordable than what you said. And, we can base it on the amount of intricacy of the procedure too. So, like we said, there's all different. So if it's just a smaller amount and it seems simpler, less complex, that we certainly try to adjust the prices of that to reflect that.
And would you say, like, when you're combining something like the clitoral hood
Mhm.
reduction or maybe a mons lipo,
Plasty or lipo. Uh-huh.
that's yeah, so that's gonna that would those would change the quote.
Yeah, we always try to, give price reductions when combining procedures. So that's always a better value if you can, do two things at one time because it's just one anesthesia then, and it's just a lot simpler. So yeah, the price will actually reduce when you combine
Right.
things.
And when I used to be in the office and I would back up the coordinators if
Hmm.
somebody was gone and I would code a patient, that first hour of the operating room is the most expensive hour. And
Right.
same with anesthesia. It doesn't double for 2 hours, one and two. It
Exactly.
just incrementally goes up. So
Hmm.
it really does lend to, maybe you do want your eyes done at the same time. We
It's
can do that.
great.
And you're going to, like you said, it's one recovery. You're at home anyway. You're resting anyway. Putting
Hmm.
ice in two places is fine.
Yeah, no,
So,
it's a great thing if a woman's kind of been thinking about it, but they also, yeah, like want their eyes done or, a breast augmentation. It's just an ideal time to combine that.
now if somebody's listening who, doesn't live locally,
Mhm.
is, do you sort of have, yeah, how do you deal with that in terms of the consultation and traveling and kind of
Yeah.
instructions for surgery?
So, obviously we do Zoom consultations, and then we would probably want to at least get, a picture via like a HIPAA confidential, photo transportation, just so we could take a look at the picture. They could probably just come in and not even have to, they could do a pre-op on the phone. We could discuss the intricacies, beforehand on the phone. And, they could basically come in town. I'd probably recommend they stay here for about 5 or 6 days, after the procedure, just to make sure everything is well on their way to healing. And then they could get back to where they want to be. Probably need a ring cushion to sit on the plane if they're flying or in a car, and it would work out just great.
Well, that's nice to know. So yeah,
Yeah.
and
Someone's out there and they live somewhere else and they want to
yeah, a
come
little
to sunny San
rejuvenation.
Diego.
Yeah, a little rejuvenation vacation for
Right.
the rejuvenation areas in more in more ways than one.
Yeah.
Um, so, if you're listening today and you have questions about scheduling or financing, or you want to, we've got reviews on our website from our patients, and we've got almost 10,000 5-star reviews now. It's incredible. But we've been surveying patients for years. And I think that's so important for people to know that, here's a person who had Dr. Breister as her surgeon, and here's how happy she is. And you can read real reviews. And, between that and I think before and after pictures and the consultation, just meeting you and knowing how approachable you are and how easy you make it. And I think we as women, for years I had a female gynecologist because I just felt more comfortable. Not that a man can't do it. It's
Yeah.
just for me, it was a comfort level.
Hmm.
And so having you to be able to, like, you're so approachable and easy to talk to, and you get it. You're a woman and you've been through all the things that women might you can relate.
Yeah.
So we'll provide links to your bio. And, I was thinking the other day, when I saw we were going to do this episode, there was an art exhibit
I
that
I
do you know what I'm
yeah.
talking about?
Yes,
So
I do. I'm
the
envisioning it in my
man, I
head,
think
like what they took molds or
they
something
took
of
molds of
many different types of
and
vulvas
yeah. And so this whole
wall.
art exhibit, a huge wall was white casts of
Yes.
women's, private
Yeah.
parts.
Yeah.
And it was like, what a cool thing. And so we'll put that in the show notes. We'll figure out what it was, but it
Yeah,
was
that
kind of
was
neat.
really cool, and it just showed the uniqueness of every single woman's body.
Right, right. So Anyway, I thank you for today.
Of
I don't know if
course.
did we kind of cover everything?
I think so. I mean, I think we touched on really a lot of different really important points. And, the main point is just, hey, if you're feeling like you've been a little bit not liking that area, I just recommend you do it because it's really worth it. It's really not that difficult to get through. And it's really, fairly affordable. So I think it's a great, great procedure.
All right. Well, thank you, Dr.
All
Breister.
right,
It was
Monique,
fun.
it's a pleasure.
And we will see you all on the next one.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Ximed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.